can start.
So, good morning, everyone. Thank you for joining us today. In the UK, we've got beautiful sunshine. So we've been very lucky for the last couple of weeks. We wanted today to go through our VelaShape 3 technology for body treatments. So Dr. Beatriz Molina ran a couple of clinics in Somerset to do with cosmetic or aesthetic treatments. And I'm also the founder for IAPCAN, which is the International Association for Prevention of Complications in Aesthetic Medicine. So it's a bit of a mouthful, but what we really do is obviously just prevention of complications and management. So going back to our summer, what most people will like is obviously a body tan. So everyone these days seems to be obsessed with exercise and healthy diet and keeping our bodies to look the best we can. However, unfortunately for mainly women, up to 98% will get cellulite. Definitely 80 to 90% of women get it, and only about 10% of men will get cellulite. And unfortunately, it starts as early as puberty and obviously can continue and get particularly during the menopause. So it's not so much hope for us when we get a little bit older. So what is obviously cellulite? We know, according to the explanation scientifically, that with cellulite, what we get is a protrusion of these fat cells into the dermis. What's happening is obviously there is a very small space where all the fat is sitting and all the septum is quite tight in there. So when the fat cells get enlarged and they get a little bit bigger, because obviously they get more fat in the body, then they start herniating, they start pushing through and creating this lumpy look, which is what we call it as an orange peel, or some people call it dimpling or a mattress effect. It's most commonly, of course, in thighs and in buttocks, but we also see it often in abdomen and even in upper arms on some ladies when we get obviously the bigger part of the fat on the lower part, and sometimes on the side of the waist and love handles. But that's when people got a bit more obesity or more severe obesity. So how it happens, as we said on the picture here, you can see where the fat is sitting in the bottom because these fats are getting much bigger, so they're enlarged. Then this septus is getting tensioned because the space gets too confined, and that obviously starts just pushing, and then that creates a dimpling. But at the same time, what we can see, of course, is the blood vessels as well as the lymphatic drainage is going to get compressed. So of course, that means the cells will not then receive the proper activation of and the proper drainage that we require in the area, and then it will accumulate even more fluids. So it really makes it more edematous and obviously a little bit worse with time. As we know, there is about 3 types of way of classifying cellulite. So we got the grade 1, which will mean mild. This is what we call it more or less like an orange peel. And normally you're going to find around 1 and 4 of the superficial depressions when we squeeze the skin. When the grade 2, which is our moderate, is a little bit stronger. So you get more than a spontaneous dimpling even when you are standing. And in that case, we seem to find at least 5 to 9 medium depth depressions, which they call it more like a cottage cheese appearance. And the skin appears a little bit more draped. So on the grade 3 is our severe one. This one is going to appear the whole time, even when you're standing, lying, etc. So it's quite a morbid obesity, but also it happens, unfortunately, during the menopause. And in this one is what people more, they call it like a mattress appearance, because you're going to have at least 10 or more of these deep depressions. So it looks like a mattress, really, because you just got a lot of dimples all over. So what causes cellulite? I mean, we do know that, unfortunately, some things like hormonal influences and poor circulation and hereditary are unfortunately not a lot we can do about it. But obviously, smoking, diet, and lack of exercise also have a big impact on this. We do know that this the exact cause of cellulite, sometimes, particularly when it's hereditary, is unknown. It's obviously seemed to be an interaction between the connective tissue in the dermatological layer, which is obviously less below the surface of the skin. So that is like that pressure in there. The fat cells in women, particularly, as we said earlier, and the connective tissue in this layer is normally arranged in a vertical way. So what happened with these fat cells protrude into the layer of the skin is going to give that appearance of the cellulite. And that's why it's less common in men, because the tissue has more like crisscross structure. So it's a little bit different the way it shows. So which is why they can have the fat, but they don't show so much of that dimpling effect. And as we've seen earlier, obviously unfortunately, hormonal factors and age are important, and particularly is to do with the estrogen, which is why, of course, it's going to get worse during the menopause. But there is obviously another hormones that do make a difference, like insulin and noradrenaline and thyroid, and also prolactin in this production of cellulite. Obviously, there are other genetic factors, as we said earlier, which are going to predistribute. And as we said earlier, the diet and lack of exercise will obviously not help it. But if you are hereditary conditioned to get cellulite, as I say, it's going to be quite hard. So you're going to, apart from having to have a very healthy lifestyle, you're going to also have to have treatments and help with this. So what solutions do we have? Of course, number one, we have to improve circulation into the area, don't we? We need to, because that's compromised, and we have to improve that lymphatic drainage, which is why partly some massages that they say lymphatic drainage massages and that activity is going to help us slightly that. But of course, we will have to also improve the metabolism for the adipocytes. So we need to get that oxygenation of the cells to improve and get the skin to be in a good condition, because if the skin is firmer and thicker, it will support better the protrusion of these dimples. So what's the solution in our clinics? For me, VelaShape. I started about 15 years ago, and I did buy a machine, which was a radiofrequency machine with a very heavy handle. So you used to just having to roll it yourself. It was like a massive workout. And if you try to do a leg, it will take you forever. And it was really painful for the arm to continue doing it. So you couldn't really repeat that treatment a few times in a day. So then we got, at that point, our first VelaShape, which was the Vela 1. And of course, it was much better, a lot easier. But when we now go to Vela 3, and we'll go in a minute in more detail of why that has made a dramatic difference, not only on the results, but on the treatments, etc., and the comfort for the therapist. So what we're trying to do with VelaShape is, obviously, as we said earlier, is to improve that cellulite and also a reduction of the circumference, because we're trying to improve the tissue quality at the adipocyte metabolism. So we're trying to work from dermis and the superficial and deeper layers all along into the fat tissue. We are using what we call a thermal effect, so it's bipolar radiofrequency. And with this, we're trying to create also collagen and fibroblast activity, as we said, and of course that blood vessels, oxygen desalination, which is very important in conjunction with the metabolic actions on the adipocytes. So as we've seen earlier, we got what causes cellulite, a list of things. So what solutions do we have for it? And as I said, it's partly, we already said it, but it's improving the circulation, it's improving the lymphatic drainage and oxygenation and blood supply and the dermal structure. So the two of them go in parallel. And we can see here one case, and this is obviously a lady who had a baby. We can see this, and originally she was very concerned, obviously, about the stretch marks and being very flaccid and loose. And just with 2 sessions, they improved dramatic on this particular page. I mean, she did lose quite a lot of circumference, and is the appearance of the skin, where it was, as I said, incredible. Obviously, we then proceed to treat stretch marks with one of the Syneron Candela machines. Well, but anyway, we're not to talk about that today. But you can, obviously, in this case, I will continue probably to alternate some radiofrequency made with the VelaShape you can then, as I said, combination of these two treatments, because you can now expand the treatment plan not to be like before, when we had to do it weekly. Of course, not everyone can do that every week. So now the fact that we can wait 2 weeks before treatments, that means you can then in between, if you need it, associate with another type of treatments. For some of you, machines, you can use them as roller, etc. So what is our technology then? So we do know that we have FDA approval, of course, and a CE mark. And this is for a temporary reduction on cellulite. And of course, for reduction of the circumference on thighs, as well as blood circulation improvement, which is obviously localized to the area we're treating. And of course, this is just coincidental, and most of you may not use it for this, but it can relieve muscle spasm. So if you got pains and aches, you can use radiofrequency to sort this out. And of course, it's a great treatment postpartum, as we've seen on this lady before, to treat the circumferential reduction on the abdomen area. And of course, it's great for after liposuction. A lot of our patients still think that liposuction is the solution to everything. They go, have it done, and they still have dimpling appearance, poor skin quality. So they still need some sort of treatment to help the condition of the skin. So it uses what we call ELOS technology. And this is a combination of 3 things. So we got the infrared, which is for superficial heating, the bipolar radiofrequency for the more deep and sustained heating, and of course it's got a vacuum, which is going to suck the tissue at the same time you are going through, and makes then the deeper penetration, because at sucking it into the machine makes then to penetrate that deeper better, but also it's going to be improving obviously the circulation into the area, and of course the lymphatic tissue, which is the more important, that lymphatic drainage. So we can see here on the picture, if you see that's one of the small heads, it's got different types of heads. You've got the smaller and a bigger one for suction, and it's got another ones where they don't do the suction, but you can apply on areas where it's very difficult maybe to suck the area because you need just a very small flat piece. But these two, the sucking ones, is for me the best when you're treating obviously the cellulite. And as I said, it's because having that vacuum effect is rolling. It's like a very deep tissue massage. It's quite comfortable, and it's obviously warm when you're going through it, but it's comfortable, and it's a great treatment. So obviously what it's doing is promoting that circulation at the same time with the lymphatic drainage. But of course, we're going to increase what? Collagen, of course, because we're increasing as well the stimulation of fibroblast activity, and we're going to help the whole extracellular matrix. So the skin is going to look great. I don't know you guys, but since I've been home for a month, my skin is not as great because I'm sitting a lot more. I'm not doing as much physically. And from when you try to do a little bit of exercise every day, it is difficult when you're not running around all day in the clinic, or, you know, like we do, running around from 8 o'clock in the morning to nearly midnight. So now things are a little bit different. So, but if you do just one treatment with the VelaShape in one area, you can immediately see an improvement of that skin texture. It's quite a lovely before and after, even for the patient to see that it's working, and it makes you to want to come back and continue with that. So it's that laxity and the skin instruction and the texture of the skin is what you can really see quite quickly. So as we said again, just to make it into a summary, the thermal effect then is going to be increase of metabolic reaction in adipocytes, fibroblast stimulation, collagen shrinkage, collagen synthesis, and deep heat and blood vessels, which causes that oxygen dissociation. We do know that obviously the adipose tissue, it plays a very important role when it comes to the body energy. So when we got the whole body energy and glucose homeostasis, which is obviously both an organ and a systemic level, the adipocytes plays that very, very important role. So we know that if we get a lipid mobilization and distribution within the body, you get a more effective way to use this energy. So, but in another hand, so we got the adipose tissue acts as an endocrine organ, or endocrine, yeah, organ, and produces sort of numerous biofactic factors, for example, like the adipokinins, which obviously communicates with another organs and is modulating all the metabolic pathway. So we all heard of the metabolic syndrome when people are getting a lot of fat intra-abdominal. So this is not the fat we can treat because this is just deep in the organs, and it produces obviously diabetes and a lot of problems with obviously weight and cardiovascular disease. So the problem is to differentiate when you see your patients and when you pinch the skin to make sure that what you feel is the fat. You can only treat the superficial fat you can pinch in any area of the body, as we said earlier, so thighs, abdomen, or arms. But beware of those people with that, they're very skinny, they're very slim, but they've got a very protruded abdomen. It goes all the way from nearly pushing on the ribs, all the way down and overhangs sometimes. So apart from that superficial fat, you're going to find they are very hard abdomens normally. They're very difficult to pinch. And a lot of that is going to be that intra-abdominal fat. So that can only be treated, obviously, with diet. So as we've seen again, in the pictures here, we can see how the rollers and the massage is going to be stimulating. We can see the loosening of the cells, because when you get the shrinkage of the adipocytes, so they get smaller rather than obviously bigger, then there is this subtly space again, so the blood vessels can start sort of going through, and the lymphatic can start taking all the fluids away. So it really is that whole combination of the three things, as we said, so infrared, bipolar, radiofrequency, and vacuum. So the three are going to cause that improvement on the metabolic action for the adipocytes. And as I said, we've seen this already, but it's just to go again. So what's been in a little bit more detail. So the heat produced is in the blood vessels, where it will cause, as we said, is that early oxygen dissociation. So from the oxygen to the hemoglobin, plus also extravasation of the nutrients and the oxygen. And of course, into the adipocytes, what we're going to see is extended use of storage. And of course, we are going to see that are going to get, obviously, they're shrinking, which means, as we said earlier, we're going to have less tension of the septum, going to be more space. And because of the heating actions, we're going to have the fibroblast activity, which of course is going to lead to collagen production. And in general, because of the collagen shrinkage and of course elasticity, etc., we're going to have that overall improvement on a skin surface. And we see again here on this how the vacuum will work. So we can see with the vacuum, obviously, you get that that pinching of the tissue at the same time that you are massaging it. So it's a continuum motions, and it just pinches out. Obviously, beware when people got very, very lax skin, that the treatment gets done on a very good pace, because if you slow too much, then it will be quite uncomfortable because the tissue gets pinched into the vacuum, and of course with the heat and the infrared, it will create like a hot spot. So the idea is just to be, as I said, aware of that, but it can be treated in any type of skin and in any area, even on very lax arms. So the target penetration, obviously, of the RF, then we have this negative pressure, and of course it produces a vascular dilatation, and of course with that we're getting also that improvement on the circulation. So that's the vacuum itself. So what features do we have on this now Vela 3 to make it different for the ones of you who's got 1 or 2? So the RF is obviously much more powerful. So we got 150 watts, and what it's going to do is when we start doing the treatment, you get that heating to start working much faster. So you just start, and after about a minute or two, you really have got that optimal temperature point, which we need to make the treatment to be effective. But at the same time, what we find, because it's more powerful, then as we said earlier, we need not only less repeated treatment, so that the time between treatments can be now 2 weeks instead of 1, but also we're going to need less number of treatments. We used to always say about 8 treatments for the previous machines, but with now, we probably find that you don't need more than 4 or 6. But to be honest, we'll show you some pictures later. After, as I said earlier, after 1, 2, and even 3 treatments, you can have sometimes in a specific patients very, very good results. It's got what we call a smart RF. What this means really is a closed loop on the RF, and it's measuring continuously the patient's impedance to ensure, obviously, you got that delivery of energy consistently, but also very safely. Also, it's going to, because it's continuously measuring, it's going to make sure you know you're doing the job properly and it's working. So you're going to have less people of not responding to the treatment. To be honest, for us, I don't think we have had anyone unhappy with it. Occasionally, we may have to combine if someone has got a massive amounts of fat, some other things. Sometimes I recommend even a bit of diet, or obviously some other things. But if you're talking about the traditional cellulite that majority of people will get, it's just on its own works amazing. So it's got as well what we call a built temperature sensor. So this sensor is going to continuously keep an eye on the temperature at the moment on the skin, and it just is beeping at you and it's telling you what's happening, and is making you to be aware that if it gets a little bit warm, you can then suddenly either release the RF or the infrared or the vacuum, whatever you think you need to do to get patients to be very comfortable. Because sometimes if people are jumping all day, it makes you uncomfortable when you do the treatment, number one, but also patients don't want to come back. So this is for me, it's a great relaxing treatment, particularly on the back of the legs and the bum and the thighs is incredible. So obviously, for the one of us which are in aesthetics, we feel that they need to look cool, because nothing worse than a massive giant machine in a corner is hardly able to move it and is horrible looking. So this is lovely. It's sleek and is very slim, white and gray. So most of us got white clinics. It's quite small. It's very easy to move it around. I mean, one of the girls could move it on their own with no help. And it comes obviously with a foot pedal, which makes a huge difference when you're using it for an hour. If you're doing large areas and you want to do, because it's about 15 minutes per sort of area you treat. But if you're doing 2 whole legs, of course, it's going to take you about an hour at least. So the foot pedal just makes it more comfortable for the staff to use it. Obviously the important thing with this, again, as we say, in clinically will be that because of the high power and the fact that it's got a bigger amount of energy to be delivered, we are going to be able to have better results, of course. But this is going to improve and optimize the patient's attendance as well. So that means that the patients are going to be more compliant to come back, because they have to have less treatments and they don't need to be coming to us as often. It has got, as we said, as an operational, making much easier for the operators, so it's much more. As well, the measurement of the temperatures we've seen earlier, so you measure the temperature in real time so we can see for patients' comfort, but also it does measure every millisecond the impedance of the in the real time. So you get a whole picture of how the treatment is happening on the screen. And of course, just to summarize in general, before we go into some of the photos, just to say that we're going to have them a deeper heat. So because of that vacuum, it's going to penetrate a lot more deeply into the cells, and it's obviously consistently releasing the temperature. It's going to maintain that control of that temperature, which is also longer, and it's going to be less time to perform the treatment, so we don't require it as long anymore. And of course, often shorter sessions, they don't have to come, as we said, so frequently. So there is a lot of different protocols. You can even design your own. So I'm already made for you. The machine tells you what to do and when to move and when to do the next thing in a step by step. But if you design your own protocol because you want to treat in a specific and you want to try something different, allows you to design also your treatment. Okay, I think we just said all of that already. We do know that clinically it works. So there is obviously some papers out there, and I'm sure your representatives can help you if you need to do some more reading. But there has been obviously some multi-center clinical trials. It's been more than 5 million of independent treatments performed globally. So it's not been around for a day or two. As I said, I have my, obviously when we started with VelaShape one very long time ago, so it's been around for a long time. It's a company you can trust because it's been, as I said, it's got a lot of experience with this machinery. They are one of the lead, and that to me is always important, because if you've got problems, you want someone you can call and give you advice. They got good training. So all these things that it matters when you have to spend a lot of money on a machine. We also know that from the clinical results, we have found that there is at least a 2 centimeters reduction in the abdomen and a 1.5 centimeters on thighs. So we can see that. And as I said, I have tried it myself. I have tried my legs and I have tried my abdomen. To be honest, I do love the treatment. As I say, it's comfortable, but it works. And I think the most important thing as well is the majority of patients will tolerate it very well, which means they don't mind coming back for more or talk to their friends. And this is some of the cases from colleagues around the world. So we got here from one of our colleagues, this abdomen, which she lost, as we can see here, 1.5 centimeters on the waist, 1.7 on abdomen, and 2 on the hip. And the weight was not much change. So that's nothing to do with weight loss. It's actually the machine. And this is 2 weeks after one session. So as I said earlier, you can see every treatment an improvement. So that gives you that sort of, oh yes, I want to carry on. Also makes you actually go home and not want to eat a pack of crisps or box of chocolates after, because you think, no, it's working and looking amazing and I want to wear my bikini. This is another treatment from, sorry, this is the other, the other lady. So 2 weeks was one session, again on the abdomen, and in this one we can see again the reduction on 1.5 on the waist, 2 centimeters on an abdomen, and about 1 on the hips. And again, plus 0.5 weight gain. So actually was, as I said, nothing to do with the weight loss. So we kind of say that. In this one, after 2 weeks, we had 3 centimeters on an abdomen and 2 on the hips. This lady did lose a little bit of weight, so probably that's why it's a little bit more lost. But what we're saying is, if you want to make it better, of course, lifestyle, and just give a little bit of advice. Sometimes give some supplementation of vitamins to your patients as well, for a bit of detox, for the ones of you that do some of that type of medicine. And that can also help. In here, we can see on the front, 2 weeks plus one session, and in this case, 0.0 centimeters on the waist, 2 centimeters on the abdomen, and 1 on the hips. And again, this one has more weight. So again, it's interesting. And a male, because of course men do also come mainly for body reduction and abdomen. We don't see so many men on legs and bums that we do with the ladies. But that's probably normal. And we can see in this case 4 centimeters. They do respond very well, actually, very, very well. And 2.5, sorry, 4 centimeters on the waist and 2.5 on the abdomen. There's another one here, 3.5 on the waist and 4 centimeters abdomen. And this is just, hopefully will play. It's just to show doing the back of the leg with the lower part of the bum. Is what they call it, a bum lift. Normally, I think we recommend only about 3 treatments at the moment, but every treatment will give you a difference. As I said, a therapist can use the hand handle, so you can do it with your own hand and push the button, or you can use the foot pedal, which I think she's using in this case. I'll be saying beware a little bit with the cable so it doesn't get too bent. I got those photos in a minute in a slide, but this is just like a quick one from a couple of bum lift treatments on a younger and an older patient. So this is an older patient of 50, and after one treatment, you can even see quite a nice lift. and considering the age and the laxity of the skin is pretty good. And this is a younger patient, had 2 sessions, and delighted, very, very happy with that. We can see last week, so it's not much in the amount of the weight, this is the fat, and it's been a repositioning the tissue and a lifting on the bum. And this is obviously the abdomen we saw earlier already. So I think in conclusion, really, I will highly recommend it. As I say, it's a comfortable patient, it's comfortable for the patient, but also comfortable for the operator, whoever, if you've got someone to help you, or if you want to do it yourself. You know, occasionally I do one myself. Not often now, I do them all now, I go have some help. But if you wanted to, it's easy to do. It breaks the day a little bit. Patients are satisfied. And yeah, I mean, I don't know, I think it will be a good addition. I think now we could pass into some of the questions, so and see if you wanted to I don't know, ask anything for me. Okay, so we got here a question from Jonathan. Thank you, Jonathan. And it's asking what is the protocol for treating cellulite? So how many sessions, what is the interval for these sessions? Thank you, Jonathan. So usually we recommend, depending on the severity of the cellulite, so if it's grade 1, 2, or 3, of course, it's going to make a difference. Minimum, I will recommend always 3 treatments for the lighter or less severe cases, and it's 1 treatment on the area affected every 2 weeks. However, if we got a more severe cellulite, like a type 3, then we do recommend a vitamin protocol with it. Maybe we recommend the lady to do some walking or something as well, daily, just 10 minutes walk. And then we will maybe have about 6 treatments because it's more severe. But as I said, it works really, really well in general, particularly on type 1 and type 2. Type 3, you do have to encourage them for the lifestyle, etc., because it's people that are older, haven't done anything for a very long time, and they just want a magic cure. And unfortunately, you do need to put a little bit more of an effort on the severe ones. We also got another question here by Andrew. How long does it take to do an abdomen, and how many sessions would you recommend? Because like we said earlier, 3 to 6, depending on how much you need to lose in circumference. But we've seen already every treatment will do some reduction. So 3 is great if you go in a small amount to lose. If you want to lose a lot more, then you can continue for 5 or 6 sessions. So every 2 weeks again. So it's always every 2 weeks. And an abdomen usually will take about half an hour max, depending if it's very large, 15 minutes if it's a small, because each area takes about 15 minutes. So it's about 2 hands, I would say. So if you've got a very big tummy, you may want to divide it into 2 because it's very, very large. Of course, it will take you half an hour. But as I said, if you've got just someone within a small tum-tum, then it's very quickly. I think we may have got another question here. Do you usually, so Raphael and Ricardi, thank you. Do you usually recommend, combine VelaShape with other treatments? As we said earlier, if you've got someone with very severe amount of fat, but say, we're talking of maybe in an abdomen, and someone has got very, very deep fat and loose skin, I tend to like to do obviously like a type of high intensity focused ultrasound first on just 1 session to take some of that very deep fat. We're talking that these people have got 13 to 18 millimeters of fat. And then we do the treatment. And then after 2 weeks, we do the Vela. And then we repeat the Vela if needed. And then we could, if necessary, repeat another HIFU and then another 2 Velas after that. And that way, what we're doing is working on the laxity of the skin and the quality of the skin and that superficial fat better. But the very, very deep, as I said, we got so many inches or centimeters of fat, then I find that you need to then obviously use another device. If it's only people with maybe lax skin and very little part of fat, Not really. We just recommend maybe a cream to use every night, not because the cream is going to do anything particularly, but it's hydrating and moisturizing, because sometimes if you got very dry skin, the skin texture is more poor. So actually it's been proven now that if you use some retinols or something like that on the skin, it just improves. So it's really just to help it, but unfortunately they take about 6 months. So we just say, oh, just use some sort of cream just to moisturize daily and give a bit of a massage, but we don't really do obviously anything else. We got another question from Said. What's the duration of his treatment session for the abdomen? So I think we already answered that one, unfortunately, because I'm sure the questions were coming earlier. But as I said, depending 15 to half an hour, depending on how large the abdomen is. Do I have any other question? I don't think we're missing. Oh, sorry. I don't think we're missing any other questions at the moment. Is there anyone from you guys up there in the panel?
I also don't see any further questions, Dr. Molina. So this is the end of the webinar.
Lovely.
Thank you all for joining.
For joining, yes, and enjoy the rest of the day.
I see one other question, Dr. Molina.
Lovely. Let's go and have a look.
Grace is asking if you can treat the arm area.
Oh, yes, of course. Yeah, we were talking earlier about the arm. So use the smaller head, and you can use, particularly, obviously, it's very good for all that saggy and little fat and loose skin. And sometimes you do get a bit of deposit of dimply skin on the inner arm. But if you go fat on all over, there is also another flat pieces you can use for areas that are more difficult. You can even go into from the arm to the armpit and into the breast part, because we get those sort of wrinkles in the area and improve the skin laxity there. And as I said earlier, we can do love handles. You could do above the knees. It's amazing. So if you got those wrinkles forming just above the kneecap, apart from you getting a bit of a lift of the skin, so you can go and if you have the mini skirt, but also just improve this laxity. So it reduces the laxity above there. So it's very good. To be honest, it's endless. Anywhere you go, you can go with it. And as I said, there is different shapes, different platforms, so you adapt to your treatment.
Thank you. There's another question here. How do you choose the type of handpiece depending the area you want to treat? So if
mainly cellulite, I prefer to use a handpiece with a vacuum. So the bigger handpiece for big areas and the little handpiece for areas that the inner arm or above the knees, we said earlier, love handles. Sometimes when you go very close to the diaphragm, that top part of the abdomen, if you go a bit bulge there, the little head can be very good, or around the your umbilical, so the belly button. Sometimes it's quite, you got loose skin around there. So for little pockets, a small head. Bigger areas, that could be abdomen or the whole front of your thigh, your back of your thigh, the bum. The whole bum is amazing to do with the big head, because obviously you are much quicker. Then you got obviously the flatter heads for areas where if you pinch in the skin because it's too loose, it will be too uncomfortable and too painful, then you can use the flat head. Or it's an area where the shape is a little bit awkward and it's not easy to mobilize, because as you saw in the video, you have to be moving the heads around in a continuous motion. Obviously, it's an irregular pattern. So you may find easier on a surface using a flat area. Can you see any other questions? I lost my mouse again, so you're going to have to tell me.
Yes, from Jonathan, there are 3 different sizes of covers for the V-Contour applicator. What would you use these for? The small applicator?
Yeah, but that's what we were talking. You have got the different sizes depending on the size of the area or the anatomy of the area, because sometimes it's not easy to use something which is pinching and you need something, the flat one, or you want to use, depending what parts you are working on. We use mainly the vacuum ones. I prefer those. The flat ones, they can get quite hot sometimes, so they're a little bit more difficult. You have to be a little bit more careful because it can be a little bit more uncomfortable. But as I said, the areas where it's not easy to pinch, or you shouldn't be pinching because it's too uncomfortable, because skin is too lax, then you can start with a flat one. Any other questions?
Can you tell us the protocol for the submental area, and if you do the treatment on the décolletage?
We got another machines for face and neck. So at the moment we're using it only for body contouring. So we're using it on myself as my personal is as I said, we got a lot of different machines in the clinic. So we use this one mainly for body. We're not using it on the neck. We use a HIFU, a different type of machine. You have to be more careful because even the small head is a very small area and it's quite difficult to pinch. I don't know. I mean, I don't have any experience on that.
Thank you. Another question, what is the protocol for the submandibular area?
Again, for face, personally, we don't use the VelaShape 3. It's obviously FDA and EC approved for body contouring. So we are using it only for the body. We're not using it on the face or the neck. You will have to speak to your own representatives and see if there is any protocols for that. But as I said, we don't use it ourselves in the clinic. So I'm talking today from my personal experience.
I also get a question, what protocol do you use for cellulite treatment in the intervals?
In where? Because we said
Intervals.
so for cellulite treatments, as we said earlier, you're going to have one treatment every 2 weeks, usually 3 treatments for more mild. And for more severe, then obviously we're going to go to maybe five treatments, or even 6 if you want. I mean, you don't have an end. I mean, this is something, and then some people may want to come later for some maintenance and continue having every so often another session. But you do get every treatment works. So you find that after 3 or 4 treatments, majority of the time people are happy, so they don't need to come for more.
I do not see any further questions.
Lovely. Well, thanks again, everyone, for being here today. Yeah, hopefully we'll see you some other point in another conference somewhere, hopefully when we can travel.
Thank you so much, Dr. Molina. This
Thank you
is the end of the
very much.
webinar. Thank you all for joining. The webinar is recorded and will soon be shared with you all that registered.